Good morning, Jerry Harry. I am Mihiraa. Let's start the warm-up sessions. Tell me a quality that you possess that suits your profession.
One quality that I possess that suits my profession as a doctor is empathy. Empathy allows me to connect with my patients on a deeper level, understanding their concerns, fears, and needs. It enables me to provide compassionate care and support, which is essential in building trust and rapport with my patients. By putting myself in their shoes, I can better address their medical issues while considering their emotional well-being. Overall, empathy enhances the patient-doctor relationship and improves the quality of care I deliver.
Do you believe there is gender disparity in your profession?
Yes, gender disparity exists in the medical profession, although it has been improving. Women are still underrepresented in leadership roles, face challenges in achieving equal pay, and encounter gender biases in certain specialties. Efforts such as mentorship programs and diversity initiatives are crucial in fostering a more inclusive and equitable environment in medicine. By addressing gender disparities, we can create a profession that better reflects the diverse talents and contributions of all healthcare professionals.
What do you find rewarding about being a doctor?
One of the most rewarding aspects of being a doctor is the opportunity to make a meaningful difference in people's lives every day. Whether it's helping a patient overcome a health challenge, providing comfort and support during difficult times, or simply being there to listen and empathize, the ability to positively impact someone's well-being is incredibly fulfilling. Additionally, the continuous learning and intellectual stimulation inherent in medicine keep me engaged and passionate about my work. Ultimately, knowing that I have the privilege to contribute to the health and happiness of others brings immense satisfaction and purpose to my role as a doctor.
How do you deal with someone who isn't satisfied with your patient care?
When a patient isn't satisfied with my care, I listen attentively to their concerns and validate their experience. I address their specific issues transparently and offer alternative solutions if possible. Open and respectful communication is key throughout the process to foster trust and understanding. My goal is to ensure the patient feels heard and valued, working together to find a satisfactory resolution.
Tell me what you feel your greatest skill as a doctor is.
As a doctor, I believe my greatest skill is my ability to communicate effectively with patients. I can explain complex medical concepts in a clear and understandable manner, ensuring patients are well-informed and involved in their healthcare decisions. Additionally, my empathetic approach allows me to connect with patients on a deeper level, fostering trust and rapport. By prioritizing clear communication and empathy, I can provide personalized and compassionate care tailored to each patient's needs.
Your preparation time is over. You can now start the role play.
Good morning, Mihiraa. I'm glad you came in. What seems to be the problem?
Good morning, Dr. Harry. Thank you for seeing me on such short notice. It's about my 16-year-old son, Milan. I'm very worried about him. He stays in his room and sleeps all day. He often says he feels too sick to attend classes and he's lost a lot of weight.
I'm sorry to hear that, Mihiraa. That must be very distressing for you. Perhaps, can you tell me what specifically makes you think Milan might be taking drugs?
Doctor, I found drug-taking equipment for marijuana hidden in his room. When I confronted him, he denied it and refused to see a counselor.
I understand your concern, Mihiraa. Could you tell me more about his current lifestyle and social behavior?
Yes, doctor, he has. Milan used to have many friends and was very active, but now he's a loner. He hardly talks to anyone and spends most of his time in his room.
It sounds like Milan is going through a tough time. What would you like me to do to help him?
I'm desperate for a solution. He refuses to talk to anyone about it, and I don't know how to reach him. Is there anything you can recommend?
Ideally, it would be beneficial if Milan could come in to see me personally.
How can I convince him to come and see you? He's very resistant.
I understand how difficult this must be for you, Mihiraa. Convincing Milan to seek help can be challenging, especially when he's resistant. One approach might be to refer him to an adolescent psychologist. They specialize in working with teenagers and can provide a thorough assessment and appropriate treatment. Sometimes, explaining to Milan that seeing a psychologist is a way to help him feel better and address whatever is troubling him can make a difference. It's important to reassure him that it's a safe and supportive environment.
I will try that. Can you also explain how marijuana can affect young people? Maybe knowing the risks might make him reconsider.
Of course, Mihiraa. It's important to understand the potential effects of marijuana, especially on young people. Marijuana can significantly impact a teenager's brain development and overall health. Firstly, it can affect alertness and concentration, making it difficult for Milan to focus on his studies and daily activities. It can also impair coordination and reaction times, which can be particularly dangerous if he's involved in activities like driving. Moreover, regular use can lead to mental health issues such as anxiety, depression, and in some cases, even psychosis. Marijuana can also affect motivation, leading to a lack of interest in activities he once enjoyed. This might explain his withdrawal from social interactions and loss of weight. Long-term use can also affect memory and learning abilities, potentially impacting his academic performance and future opportunities. Explaining these risks to Milan might help him understand the seriousness of his situation and encourage him to seek help.
Thank you, Dr. Harry. I'll do my best to talk to him and persuade him to seek help.
Absolutely, Mihiraa. It's wonderful that you're prepared to support your son in seeking the help he needs. Here are some thoughtful approaches you might consider. First, it's crucial to approach the conversation with empathy and understanding. Start by expressing your concern and love for him, making it clear that your intention is to support, not to criticize. For example, you might say something like, "I care deeply about you and your well-being, and I've noticed you've been struggling lately. I think talking to a professional could really help." Mihiraa, it's also helpful to normalize seeking help. Sometimes, people hesitate to see a psychologist because they feel ashamed or believe they should handle their problems on their own. Reassure him that seeking help is a sign of strength and that many people find it beneficial. Sharing positive stories about therapy, whether from people he knows or general anecdotes, can help demystify the process and reduce any stigma he might feel. Encouraging him to see a psychologist can be made easier if you provide support in practical ways. Mihiraa, offer to help him find a suitable therapist or go with him to the first appointment if he's comfortable with that. Sometimes, the first step feels daunting, and having someone supportive by his side can make a big difference. Moreover, it might be useful to have an open and honest conversation about his feelings toward therapy. Ask him about his concerns or fears and address them with understanding. Sometimes, People are more open to trying therapy if they feel their specific worries are acknowledged and taken seriously. Finally, be patient and persistent, Mihiraa, but also give him space to make his own decisions. It's important that he feels in control of this process and that he's making the choice to seek help for himself, not just because he feels pressured. Approaching the situation with compassion and support will help him feel valued and understood, which can make him more open to the idea of seeking professional help.
Thank you so much, doctor. I appreciate your advice and support.
You're welcome, Mihiraa. Take care, and don't hesitate to reach out if you need further assistance.